Organ donor risk factors. Potential organ donor risk factors. There may be some donor-related factors that could affect the success of the transplant surgery for all organ transplant recipients. These factors include, but are not limited to, the following: the donor's medical and/or behavioral history, the donor's age or condition of the donor heart, transmission of serious infections, cancers, or other diseases to you from the donor heart. All potential donors are screened by the OPO per UNOS policy and by your transplant team prior to organ acceptance. PHS increased risk donors. The Public Health Service, or PHS, identifies donors with specific characteristics that may increase their risk for transmission of certain viral diseases, including HIV and hepatitis C. The transmission rate for these donors is unknown, but estimated to be 1 in 10,000. Transplant with an organ from a PHS donor may have a lower risk of death than remaining on the waiting list. Your physicians will speak to you about this option, and you will sign a consent form if interested in considering these donors. PHS increased risk donors. You will only be offered an organ of this type if there is no evidence of virus by the most sensitive NAT, or nucleic acid test, and after a discussion of the estimated risks among your physicians, who will determine if the benefits of using this donor for you at the time of the offer outweigh the potential risks. You have the right to refuse this type of donor without penalty, and you will be told that the donor is identified as a PHS increased risk when you are called for a transplant.